Hello, 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 everyone. My name is Beverly Castleberry. I'm a certified health coach and personal trainer. It's been a little bit since I've been on YouTube, but I thought I would come back today to record a video because we are at the beginning of summer, and there are three illnesses that I wanted to talk to you about to make sure that we are all able to enjoy summer with our family and friends. And those three are heat cramps, heat exhaustion, and heat stroke. Now, the heat stroke is the severest and the one that can be fatal. And next to it is heat exhaustion, and the least serious are heat cramps. And let's start with heat stroke. The primary symptoms for heat stroke is a body temperature, and this is really important, a body temperature of at least 105 degrees Fahrenheit or 40.6 degrees Celsius. And some of the other symptoms of heat stroke include warm and dry skin. Now remember that's very important when we compare heat exhaustion. Heat stroke, warm and dry skin, a fever, increased heart rate, very shallow breathing. The person may have a loss of appetite. They may be nauseous. They may be vomiting. They may have a headache, a throbbing headache, dizziness, lightheadedness, fatigue, confusion, muscle weakness or cramps, agitation, and there just is a lack of sweating. That's really, really important that you remember. And in the worst case scenario for heat stroke could be seizures, coma, and death. So let's try to remember those. And then there are fewer symptoms seen in patients suffering heat exhaustion. And those symptoms include muscle cramps, pale and moist skin. That's the difference between heat exhaustion and heat stroke. Fever, again, nausea, vomiting, same symptoms as heat stroke. Here we have diarrhea. Headache again is there. Dizziness is there. Fatigue is there. Weakness, anxiety. But just remember the heavy sweating and a rapid pulse. Those two things really distinguish heat exhaustion from heat stroke. And then as for heat cramps, the symptoms are, just painful cramps, particularly in the legs and in the muscle group. That exert energy, red and moist skin, and dark colored urine, which is the primary sign of dehydration. Remember the dark colored urine. Now, the first aid and treatment for each of these, let's start with heat stroke. It must be given urgently since this is the one that can be fatal. If the person is exhibiting symptoms from a heat stroke, call emergency medical services immediately, or if possible, take the patient to the nearest hospital. And if you're waiting for emergency medical services, let the patient rest and stay in a cool and shady place. If there are extra clothes, change the outfit to something cool and comfortable. Fan the patient, allowing cool air to circulate all around them, and drench the skin with cool water, or either place ice bags or ice packs either under the armpits or the groin area. And that is because this is where there's a lot of blood supply close to the skin. And when you place these ice bags there, it decreases your body temperature. All right, so if the patient is capable, allow them to drink cold fluids, particularly water. Do not give them alcohol or any diuretic product. That would lead to more water loss. And for heat exhaustion, allow the patient to rest and stay in a cool and shady place. Change the outfit to something cool and comfortable again, and let the patient drink sports drinks that have a lot of ions in it. And if symptoms persist, take the patient to the nearest hospital where they may be given IV fluid. Now, if the patient is not treated adequately now these are the symptoms of heat exhaustion, heat stroke can follow. So make sure that you get them adequate care. Last but not least, of course, are heat cramps, and they're treated in the same way. Allow the patient to rest and stay in a cool and shady place. Change the outfit to something cool and comfortable, and drink ample fluids, and make sure you stretch those affected muscles. Okay, so those are the three illnesses that you want to really keep an eye out for during the summer months. That was heat cramps, heat exhaustion, and heat stroke. Again, my name is Beverly Castleberry. I'm a certified health coach and personal trainer. Please follow me on Facebook, Beverly Castleberry, health coach, personal trainer, and professional speaker. And you can also follow me on Twitter and Instagram at Fit Life After 50. Okay, see you next time. Take care. Have a great summer.